Why are they constantly asking me what birth control I want? I just had a baby and I'm breastfeeding, so I can't even take it. Oh, I know the answer to this one. I'm Dr. Fran. I'm a board certified OBGYN and a mother of 3. Let's talk about why we recommend birth control after you have your baby and which ones you can take while breastfeeding. Why are those pesky OBGYNs always talking about birth control after you deliver? We know that having babies too close together increases certain risks, specifically the risk of preterm labor in that second pregnancy and the risk of babies that are born too small of a size. That's why we bring up birth control often during your 3rd trimester prenatal care and after you deliver, so we can talk about your options and ways that you can help space your babies out. Of course, we have our non-hormonal options. So we have our natural family planning, which may not work so well for you if you're breastfeeding. We have condoms and, of course, sterilization. When it comes to breastfeeding, you can still have hormones. We most often recommend that you stick with the progestin-only forms versus the forms that contain estrogen. The ones that contain estrogen are the combined pill, the ring, and the patch. If you have an exact or low supply of breast milk, these are very likely going to decrease your milk supply. So if you don't have a lot of supply, I would stay away from these. If you have an oversupply, you're not so concerned. These still can be used a month after your delivery. But we still have lots of good options. We have the progestin-only pills. These can either be prescription or now over the counter. We can do the next one on arm implant or the Depo-Provera shot, and both forms of the IUDs, both the hormonal and the copper version. When it comes to the progestin-only forms of birth control, these theoretically should not decrease your milk supply.